on the ground. Today, our focus is on healthcare and well being, a matter that affects every Timorese family, every community, and the future of the nation. From maternal and child health to communicable diseases, Timor-Leste's health sector faces layered challenges. Yet, with national leadership, global support, and community engagement, the path forward is filled with opportunities. With us today are distinguished guests who bring policy, expertise, and program action to the table. With us today are distinguished guests who bring policy, expertise, and program action to the table. We have Dr. Arvind Mathur, WHO representative. Welcome to the program, Arvind Bhai.
Thank you.
We have Dr. Dominguez Bernardo. She is UNFPA's assistant country representative. Welcome to the program, Mana Dominguez. Thank you so much for joining us today. I welcome you to the program, which is around challenges, barriers, and strategic response within the health sector. Thank you so much. I think taking lead from this, I will get back to you, Arvind Bhai, on my previous thought and question about, we Timor-Leste has seen lots of these successes, but the recent one, 3 eliminations, I would like to mention rubella, lymphatic filariasis, and malaria in 2025. So how does WHO view these milestones in the context of health system strengthening, and what are the lessons you would like to share which can be applied to tackling TB and other communicable diseases, referring to your, the 3-tier burden we are facing at the moment in Timor-Leste?
Thank you so much for this, again, a very interesting proposition and the question. And I would just reflect to also what Dr. Dominguez had said, because she had pointed out health system criticality from a maternal health point of view. And I share all those because the partnership and working together makes a lot of difference.
Yes. A lot of difference.
And whether it is maternal health or it is disease eliminations. Because the reason I am saying is that none of these things work individually or in vertical manner. And it is very important for us to remember that they go far beyond defeating an individual disease. Certainly, like these triple eliminations are remarkable for Timor-Leste.
Very true.
I mean, it not only have the effect on the health system, but also on the esteem of the people, that they will no longer be suffering, or the children will no longer be suffering from the diseases like rubella or measles, or the debilitating condition like filariasis that has affected many people in the country, and more recently malaria. But it is easier said than done, like to say in a tropical country like Timor-Leste, malaria as a disease could be eliminated. So for us, it was again a very broad, systems approach.
Very true.
That we led to starting with our advocacy with the political commitment. Unless and until there is
political commitment is not there.
Absolutely critical.
Nothing can happen.
Nothing can happen. And that was our very first effort to have the sustained political will. And we are very grateful that in the last 2 decades, respective and successive governments remain committed to the efforts of eliminating malaria. And, from political will, the other end is actually unless people accept the interventions that we bring in. Like Dr. Dominguez was referring in relation to the acceptance of traditional attendants, but people not coming to the facility.
Coming to the facility.
Same way, like if we bring say, insecticide-treated bed nets and people don't accept them, we cannot eliminate anything. So, in every intervention, we have lessons and we have the effort that needs to be, that is interlinked in a way. So like, for example, building on to the last year lymphatic filariasis elimination, this year in July, we got the malaria certification. All of this from political will to community engagement links also with the smart investments. the smart investment is both from domestic resources, but also from our partners. I mean, in the case of malaria, we must acknowledge the generous contribution that has come from the Global Fund. And they continued their investments on the technical and evidence-based solutions that WHO was advocating, be it the insecticide bed net for the people to use, or we call it as indoor residual sprays, and then community, working with them for community engagement, but importantly with the health workforce training, with the transportation to be ensured, so that the, as was stated in other contexts, that evidence-based trainings, evidence-based policy, evidence-based advocacy, all of this resulting into actions with the community that is actually possible for the Ministry of Health and the team to push forward. And in this case, something which is very, very critical for us to remember is the data, is the data for decision making. And we are very glad that we could bring in innovations. We can bring in the newer technology, but open source. For example, a DIHS2 based Timor-Leste health information system, and more recently, the case-based surveillance. So from aggregate data to individual data that resulted in a case-based approach for malaria elimination, for filaria elimination, and linking it up, also with other eliminations like rubella, because we could put that surveillance in place where the health ministry at different level is able to track the case individually and also take action around if there is a case. And this is something which I would say, when you ask me, are the lessons being applied elsewhere? This is what we are doing in the case of accelerating and fast tracking ending tuberculosis in Timor-Leste. And to that extent, when I say about case-based surveillance, we have been very fortunate that the government of Timor-Leste, Ministry of Health, had accepted these technological adaptation. Timor-Leste is one of the few countries which is using AI-enabled digital X-ray for TB screening. Wow. They are one of the few countries which have a one-stop TB mobile van, which is equipped with a digital X-ray and also a kind of a molecular diagnostic machine called TrueNet. So, again, building on to this is something which is helping us, getting the screening closest to the people, that allows us to then immediately put the TB patients on treatment. And contacts of them on preventive therapy, help us to build on the treatment adherence. And Timor-Leste, as a result, have shown a 55% decline in tuberculosis-related deaths. Wow. So, these are the lessons.
Huge achievement. It's a huge achievement.
So, if I can just say that how, we are looking into it, because when I said about Global Fund, their investment is substantive. $15 million that they have given us in the last cycle, but it has been sustained even earlier to the Timor-Leste, that the 15 million that has come in. But over and above this,
50 million?
15
million, okay.
Over and above is the government own investment. And, then partners like WHO and others which are there globally, that we have been able to bring in as well, down with the community organizations, with the civil society, with other partners. And to that extent, I would say that, also the repeatedly saying this thing about political will, the political commitment, that has been one lesson for us, that for anything that would play so very, very critical role. So in a way, political will, integrated systems, bringing technology and innovations, and partnership and collaboration are, to me, the lessons that we have learned from these eliminations and been applying to tuberculosis and in other diseases and many other conditions as well.
Many other conditions. And I must add that, one of the most amazing thing in Timor-Leste, which links to the advocacy and government's ownership and leadership, and the political will you mentioned.
Yes.
And that links to the UN's historical role and the trust and confidence Timorese leadership and Timorese people have on UN. And I think that allowed us to contribute to that extent. It's really amazing. Both of you mentioned something very interesting about, access and access linked to public behaviors. So my question is to both of you, maybe we can quickly, have your reflections on that, and then we can move to to particularities, other questions to you and to UNFPA. That in terms of public access, in terms of access and behavior, what are the main reasons, like, you mentioned, and Arun, you also mentioned, that people avoid or delay seeking care, even when services exist? What do you think? I mean, quick reflection, Mana Dominguez, from your side, and Redhai from your side. What are the reasons? I mean, that you mentioned that that services are there sometimes, not sometimes, most of the times, but people don't access those services. What do you think? I mean, what is at the back of their minds?
Okay, I think, again, I use, it's beyond health. It's a socioeconomic determinants, very influence on seeking for health, seeking behavior. So number one, again, I want to say is, of course, limited knowledge.
Very true.
Knowledge. Again, for maternal health, on danger signs, they don't know that when they have to go. They don't know that the importance of antenatal care during pregnancy. They don't know that during delivery, probably they will face this complication that they need to be attended either in a facility or by skilled birth attendant, but home delivery by mother-in-law or by traditional birth attendant. So that's number one. Number two is because of, again, the distance. If you see, people are living
they might think, it's very far off.
I have to go there? I have many kids to look after.
What to do? Let's leave it for the time being. Arvind bhai, your quick reflection on that.
I'm agreeing to what Dr. Dominguez is saying. I mean, let me put it up in this way. The first, to me, that why people delay seeking care is a whole element of trust on health system. If I don't trust that if I reach the facility, I'll get the care, I will not come to the facility. And this actually gets linked with what Dr. Dominguez was also reflecting on the quality. You see, even if I reach, whether I am receiving the quality services or not, whether I am receiving the services from, like what was said by Dr. Dominguez, trained manpower, do I get the quality which is what I feel satisfied with? So true. To me, these two factors are very critical, which results into the delay in seeking care by anyone. We have seen it during COVID-19 times. We have seen it in the normal times, that if there is no trust, people would not come. And the perceived notion about quality, because if I say, oh, this provider or this facility is providing better quality, it's just a perception. People don't know the nuances of the quality. So that's where the,
it's a very technical
area, but also the lack of awareness, lack of knowledge, lack of understanding that it is good for me to deliver in facility and not at home. Because as was said, that almost 6,000 deliveries can develop complications. And we do not know which of these 6,000. So I need to have that awareness that I need to be at the facility to receive care, to receive, timely quality services that a trained midwife can give me or a skilled provider can provide me. So to me, these are the few factors which results, apart from the very kind of a overall socioeconomic factors that we were reflecting on, be it the people's ability to get timely transport, be it the distances, the geographical terrain, and although it is free care, but if I have a lack of trust, then I would land up paying out of pocket, thinking that other provider may be better quality, which may not be the case always, but that is the reason to delay the care. And then when I could try and come to a higher facility, the desire to go to a higher facility all the time also makes the delay in care. And that's why we need to stress and repeatedly focus on primary health care. That's the care closest to the people.
That is the
and the importance of that needs to be understood by people as well.
So this brings us to the close of the program. Thank you so much, Arvind bhai. Thank you so much, Mana Dominguez, for joining us today. Today's dialogue reminds us that health is not just a sector. It is the foundation of human dignity, national development, and better future. From policy to practice, the commitment to improve healthcare in Timor-Leste is real. But it will take all of us working together to turn the vision into a reality. To our guests, thank you for your leadership and insights. And to our viewers, thank you for tuning in. Until next time, stay informed, stay healthy, and continue raising your voice for better Timor-Leste. And goodbye, and thank you so much.
Thank you.
Thank you very much.
Obrigado, Bara.